Well, it's important that the entire population be healthier, and it's always been important, but I think the Affordable Care Act has heightened our sensitivity around that. So the only way we're going to solve the healthcare crisis in this country about escalating costs is if everyone's healthier. We're all in this together, that particularly from the public health perspective, it's everyone's job. And healthcare is only 10% of the equation of what keeps us healthy. And only 30% is that you pick the right parents. The rest of it is really your own behaviors and where you live. And the healthier the community is, and it affords us opportunities to walk and recreate and have healthy food, the healthier we'll be. So it's all linked together. And we like to say that everybody's part of population health and public health. It isn't something that those people at the health department do. It's something that we all need to do every day. We can absolutely do this. It's spending the money and devoting the resources thoughtfully. And it doesn't take more money. We just need to be smarter about how we spend the resources we already have.
We realized we really had been interested and involved in health efforts already, just from trying to promote alternative modes of transportation. But we had been looking at it just from a transportation perspective, like it'd be good to reduce traffic congestion to have alternative modes. But then when we saw the health connection, we realized, boy, it's not only good for traffic reasons, it's also good for reducing air pollution, which is a health concern. It's also good for just the physical activity and helping people live healthier lifestyles. And so there was a big proportion of your health is really related to the place that you grow up and that you live in. And so that, I think, was a kind of a light bulb for a lot of folks at our table to say, oh, we should make sure that as we're thinking about our community, that we're addressing those things that will help us be healthier.
Everybody kind of came together to start a program that would help seniors and people with disabilities improve their access to transportation. Our volunteer drivers have a very tangible effect on the health and well-being of seniors and people with disabilities in Chittenden County. And they do it simply by helping them get where they need to go. Part of that is getting to medical appointments. Part of it is for critical care or chronic treatments. Part of it is physical therapy. It's to go to the eye doctor. It's to get to extended care facilities, to visit their spouses. It's to go grocery shopping, the pharmacy, get their hair done. I think every one of us, if we're fortunate to live a long life, are going to be in a similar situation. So it's kind of a way to pay it forward and to try to help somebody get where they need to go right now, because at one point you're going to need transportation too.
The lack of access to nutritious food at various times, at all times across that lifespan, can have really significant effects. It affects the physical and cognitive development of children. It affects their ability to engage in school, to learn in school, to stay in school. And one of the biggest risks at all ages is the association between food insecurity and overweight or obesity. But I think as a community, we all agree that at the very basic level, all people should have access to healthy food that they can afford. Whether or not it's being provided and who's paying for it, it should be affordable and anybody should be able to get it. We don't necessarily all need to do more. We don't necessarily always need more resources. If we can align the work that we're doing, we can get much further as a community.
Chittenden County is already, maybe the healthiest county in the country and in Vermont. But when you look at why is that, it's because we have so many of those things in place. People can walk in large parts, or they're out on hiking trails or biking trails, or they have access to farmers markets and fresh food and things like that. So that is what makes us healthy, and it's the things that we want to kind of build on to get healthier.
Well, I've done almost 35 years of research here based at Dartmouth, working with Jack Wenberg, who did the first studies in Vermont, first studies in the country, based in Vermont, comparing healthcare across the 11 hospital service areas in Vermont, and finding remarkable differences in quality and spending, and then setting a whole agenda for research for the next 30 years to say, why does healthcare differ so much across communities? Why are health outcomes so different? And what can we do about it? So as we've looked across the country and seen twofold differences in spending, unrelated to the underlying health of a population, and dramatic differences in health, unrelated to healthcare spending, a bunch of us realized that it was really important to start to say, how can we think about improving both health and healthcare locally in order to create sustainable health systems?
I've always had an interest in health. I think it goes back to my days as head of human resources at Hypertherm. We have piloted so many things in the company where I work, and just seeing what can happen when you invest in healthier foods, exercise programs, getting people engaged, practices that we've embedded within our work culture. I would love to see them play out more broadly in the community.
One exciting thing that we're doing is a baseline health measure in Claremont, New Hampshire, that is really driven to get a measure of individuals' health in order to help leverage resources for that community that has been so challenged over the last several years. It's great work. It's a lot of fun. It's been great meeting so many people in Claremont that are interested and passionate about making their city healthier, and it's, you know, getting them to agree to fill the survey with their employees or the people they serve, their clients or customers. For many of them, it's been a no-brainer. They're eager to do it and are looking for ways to encourage others to do so. So far as things that are in the works and working going forward on the Vermont and the New Hampshire side is really our workshop series that has just launched, and it's an opportunity for organizations that have projects that they're working on now, that have programs that they've been working on and maybe for years, maybe it's a brand new program, but to really have the expertise that people affiliated with Rethink and TDI can bring to the table. So things around quality improvement and measurement and assessing the program and getting it to build some capacity so that it can either spread or serve more people and be more efficient at what they do, also with the goal in mind of leveraging more resources to support that work.
Well, you know, one of the remarkable insights from this work, and you know, in retrospect, it's kind of obvious. You know, both health and healthcare are locally produced. You know, health is produced by the schools, the kinds of communities we have, the physical infrastructure we have, what kinds of educational and occupational opportunities people have, the physical environment in terms of walkability. That's what produces health.
It takes a village, and it takes time. I think it's really important to have a strong foundation where we're all clear on where we want to go, how we want to get there, what success looks like, and then step back and say, okay, now what do we need to do to get there?
Most of the country is interested in reducing obesity rates. So we started talking about what can we do in this community, what makes sense, and we ended up talking about bringing some community leaders together. We had a broad range of people that we invited to a meeting and said, come and talk with us. We want to talk about what can we do to make our community healthier. So by the end of that meeting, it was an hour and a half, and we asked everyone there, I think there were 25 folks there, what do you think? Do you think this is worth pursuing? Are you interested in being part of it? And unanimously they said, yes, we want to be part of this.
We've identified that obesity is a problem in Franklin County and one that we want to combat. And part of the ways that we are doing that is getting a collection of interested community leaders to collaborate and find meaningful ways to impact that I guess, negative trend of increasing obesity in Franklin County.
The vision is to overall reduce the obesity rate in Franklin and Grand Isle counties. And in doing that is in engaging the entire community.
Well, I did a presentation around the data for our area and what our statistics were. And Jill talked about the need for really reducing healthcare costs, and chronic disease was one of those issues that the hospital and we all need to address. We want to reduce healthcare costs. If you reduce obesity rates, you can reduce heart disease. You can, so there's this correlation between working on prevention and reducing rates of disease in folks. And we know there's a lot of focus on individual behavior, and that's where people usually go when they want to create change. I think if people would just do X, Y, and Z, they wouldn't be overweight. But you also have to include relationships. What's the family relationship? What other social relationships are there? Then you have to look at organizations. This is another piece of it. I mean, where do they work? And do they have access to healthy behaviors like healthy food and the ability to get out and move around?
One of the main goals was when we first started this was to vet, can we really make an impact, and if so, how, and what areas should we focus on?
As far as organizations, when you think about the benefit of it, because it's having your employees with good attendance, and absenteeism is sometimes an issue. But if employees are healthier and they feel better coming to work, then they're more productive, their absenteeism goes down.
Some of the main areas were getting the schools and children involved at a very young age, because I believe that if you can start to teach a student, a child, healthy living, healthy eating habits, exercise at a young age, they're going to be likely to utilize that further in their life. So that was one of the main areas that we wanted to focus on. Also looking at what resources do communities have, whether it's walking trails, whether it's access to safe, clean paths to school, for an example, for children to walk. So some major areas we really focused on that we felt we could provide an impact and an immediate impact to try to slow the progression of what's really an epidemic.
This community has a great history and track record of working together, collaborating on important issues, and to see the number of people coming to the table to have this conversation is such a great sign that it's only going to grow and get better.
And this Rise Vermont isn't something going to be outside of a business or a community, but something that they take and make alive. Because it's not going to be perfect for Enosburg to Richford to South Hero. It may not look exactly the same, but the logo will be the same, and for that community, they will have brought it alive of what it means for them. It's about helping organizations and communities retool the resources that they have, and that does become very empowering to incorporate this and not have to depend on additional resources or thinking you can't do it because you need something else. But it's really kind of retooling what you have inside and getting the folks in the community or in your organization to sit down and talk about the priorities together. So it's not just coming from the leadership, it is achievable. But it's a journey, and one we're going to have fun doing, and we're going to celebrate the milestones, and if things don't work as planned, we're going to regroup.
It's about our community well-being. It's about economic well-being. It's about feeling safe where we live. So when we look at this initiative that's being undertaken and how it connects to the broader picture, I think it gives us the opportunity to address all those things.